A town hall meeting was held in Leslieville last night to discuss safety concerns in the wake of the fatal shooting of Karolina Huebner-Makurat earlier this month.
This isn't about whether safe injection sites should exist.
Stop doing this horrible advocacy that you're doing.
It's also, and it's not about.
Join us in calling for more supports for people if that's what you believe.
It's not about whether
supports for people.
It's not about whether safe injection sites are a public good. What this is all about, from our perspective, and we've been trying to air these concerns to the community center, to their senior executives for years, and they have completely ignored us. And the truth of the matter is, they haven't managed the safe injection site properly.
Well, we're joined now live by Jerry Brown, who's a concerned Leslieville resident and one of the organizers of last night's meeting. We appreciate your time, and we understand things got a little bit heated last night. Tell us a little bit about how the meeting went, and what were the concerns that organizers like yourself and residents of the area are raising?
Well, I think it was very expected that it was going to be a little bit heated and emotional. This is a hot topic, and we completely understand that. People have big feelings about it, and that is fair. They're allowed to. I think in terms of the event itself, it was surprisingly calm. We did have all levels of government present. We had reps from the Toronto Police, Toronto Public Health, and the health center itself, who were all there, which was lovely to see. And I think what we did learn is that, this community is very engaged when it needs to be.
You're right. This is a very highly contentious issue. On one hand, we have compassionate people who want to help those who are dealing with addiction and crisis, who want to be able to, have these people in their communities. But on the other side of this argument, you've got very concerned residents who have family members and children who are exposed to constant harassment, violence, break-ins, urinating and defecating on their property. And these individuals have very legitimate concerns. But I'm curious, do you think that some of the minority voices are that there's a louder minority on this particular argument, that it's no, these safe injection sites, they need to stay, and we don't really care too much about your concerns?
I don't know if that's entirely a fair question. I think everybody's concerns, whether they are the quiet majority or not, are legitimate. We went into this town hall, and we've said from the very beginning that our objective is to find a solution that includes supports for everyone who need it. That includes some of the people who are the clients of the site who rely on programs like the supervised injection site. But then it also includes, our kids who are walking to the park and picking up bags of fentanyl. And, yesterday morning, a 5-year-old picked up a needle in the playground of the school. So something is not working. Mm-hmm. And, I think the funny thing is, when Derek and Desmond, you showed them just now, were getting into an argument, they didn't seem to realize that they're actually on the same side. Nobody wants to shut this program down. We're very, very in support of this program. We know how many people it helps and how many lives it saves. It's about something's not working. So where's the accountability, and how is specifically the health center, the police, and all levels of government going to do what they are required in order to ensure that the program runs effectively and properly?
The concerns that I've been hearing is that people in the community, they're okay with the injection site. They're concerned about how it's being run, but there is also the other side of the concerns, is that for individuals who look at these injection sites, and the experts say this is about harm reduction and providing a safe place for them to do their drugs and not overdose and die. On the flip side of this argument, you've got residents who are saying this is a short-term fix. When we're looking, we want to see long-term solutions rather than just providing a safe place for people to do their drugs and essentially destroy their life. They want to see these people in treatment. And I'm curious, what is your reaction to kind of municipal, provincial, and federal government on their role in this situation? Are they doing enough to provide long-term solutions rather than just providing a safe place for people to do drugs?
I mean, of course they're not doing enough. None of them are. We got a whole bunch of politicians with their key messages yesterday. We had the CEO of the health center who came armed with a PR team, and I'm somebody who has worked in PR for 15 years, so I see it right away. It takes one to know one. So the challenge is, how do you counter the lip service and key messaging with actual actions, like real actions and a real plan. One of the goals that we always had for yesterday's town hall was let's find some short-term solutions, but long-term objectives too, because you're right. I mean, we were never going to solve the overall opioid crisis at a town hall last night. I keep joking that somebody should win a Nobel Peace Prize if we do. But why can't we try? We really want to have the discussion. My phone's been blowing up all day with people going back and forth who were at the event yesterday, coming up with different ideas. And we want to hear all voices, but we just want to make sure that our objective is all the same, and that is help everybody who needs the most help. And that includes our kids, and that includes clients of the program.
Jerry Brown, we appreciate your time. Thanks for joining us on CP24
Thank you
Live
so
at
much
noon.
for having me.